Neurologist Antonio Damasio began his classic book Descartes' Error with the story of one of the most important patients in the history of neuroscience, Phineas Gage. The tragedy of Phineas Gage has been narrated in countless scientific and popular forums, but Damasio's is perhaps one of the most lucid and comprehensive. And this most dramatic catastrophe has come to symbolize the sudden impact and the long-term consequences of traumatic brain injury. The disaster transpired in the summer of 1848 in New England when Gage, then a 25-year-old construction foreman, was working for Rutland and Burlington Railroad. Damasio described Gage as efficient and capable, qualities which, however, failed him on the fateful day. Gage was leading a team that was laying down railroad tracks through rocky terrain, the strategy being to blast the stone and make way for a straighter and more level path. Damasio wrote that Gage had just put powder and fuse in a hole and told the man who was helping him to cover it with sand. But just then someone called him, distracting him for only an instant when he looked away over his right shoulder. Returning to his task and not realizing his assistant hadn't put in the sand, Gage begins tamping the powder directly with the iron bar. In no time he sets fire in the rock and the charge blows upward in his face. Hello, I'm Ibrahim Imam and welcome to another episode of the Neurology Lounge podcast. Thrown to the ground and stunned, Gage suffered a few convulsive jerks of his limbs, but was otherwise none the worse for someone who had just had the most bizarre head injury. After his head wound healed, Gage was pronounced cured in less than 2 months. There, the tale of Phineas Gage would have ended, but for the lasting change it wrought on his personality. Damasio wrote that Gage's disposition, his likes and dislikes, his dreams and aspirations are all to change. From foul language to disrespectful behavior, Damasio used this story to show that previously acquired social convention and ethical rules could be lost as a result of brain damage. Amongst Gage's other deficits were difficulty anticipating and planning for the future, loss of personal and social responsibility, inability to make good choices. John Fleischman expanded further on the deficits that Gage suffered in his book titled Phineas Gage, a gruesome but true story about brain science. Fleischman described how, on returning to his job, Gage's colleagues and employers discovered that he had become unreliable and at times downright nasty. Fleischman explained that Gage insulted his old workmates and friends, used vulgar language in the presence of women, and changed his mind and his orders from minute to minute. A less familiar but equally emblematic historical account of traumatic brain injury is that narrated by neurologist Alexander Luria in his book titled The Man with a Shattered World. There, Luria narrated the case of his patient Lev Zazetsky, a soldier who had sustained a head injury while fighting with the Russian army against the Germans at the Battle of Smolensk in 1943. Zazetsky was commanding a platoon of flamethrowers which was advancing towards the German line when he said, all at once there was a burst of fire from their side, machine guns whirring in all directions. He remembered experiencing a sharp rending pain in his head. but his next recollection was of coming round on an operating table in a tent being held down tightly by several men as he screamed and gasped for breath, with warm, sticky blood running down his ears and neck. Zazetsky's battlefield record showed that the bullet that hit him penetrated the left parieto-occipital area of the cranium. The impact of this head injury was far-reaching. Zazetsky said that because of my injury, I had forgotten everything I ever learned or knew and had to start from scratch to develop again. He added that up to a certain point, my development suddenly stopped, and I have been that way ever since. He said, my mind was a complete muddle and confusion all the time, and whatever I do remember is scattered, broken down into disconnected bits and pieces. At their first meeting, Luria said Zazetsky was unable to add two simple numbers, recognize letters, write, remember common words, or describe a picture. Although he could name the months of the year fluently, he couldn't tell his right or left hands. But it was his visual symptoms that were the most distressing for Zazetsky. He was unable to see any object as a whole, and what he did see was never stable. Luria said the objects would glimmer fitfully and become displaced, making everything appear as if it were in a state of flux. Zazetsky also had difficulty negotiating his way around familiar places. For example, he got lost finding his way back to his room, and when he returned to his hometown, he was unable to recognize the streets as the place appeared, in his words, a completely strange and unfamiliar world. The two accounts I have narrated highlight two long-standing mechanisms of traumatic brain injury that have weathered time and are still potent mechanisms today. But a relatively more recent account of traumatic brain injury also highlights a more modern cause of traumatic brain injury and its equally devastating effects. And that is that narrated by Kathy Crimmins, titled Where is the Mango Princess? Crimmins narrated the case of her husband Alan, who was involved in what she referred to as a silly, horrible, stupid accident in which she said his brain got run over by a speedboat. The accident occurred in Canada, where the family was on holiday. On arriving at the scene, Crimmins said she saw Alan lying splayed across the stern of our little metal skiff, strangely motionless except for an occasional rapid jerk of a leg or arm. I've since found out that skiff means boat. She added that his head rests crookedly on the back of the motor and that it looks as if he's fallen backward onto the outboard. The boat itself, she said, was twisted and crumpled on the outside like a tin foil. She later learned that the other boat actually went up and over Alan's head on the left side, and the whole left side of his neck and face was scraped and his ear torn. At the hospital, the neurosurgeons told her that the impact to his head was equivalent to going through a car windshield at 70 miles per hour. As he was being evacuated by air ambulance, Alan started making guttural noises, became increasingly agitated, and then had a grand mal, or generalized tonic-clonic seizure. Amongst the risk factors for developing post-traumatic epilepsy are loss of consciousness at the time of the injury, amnesia for the event, brain contusion, and intracranial bleeding, all of which Alan experienced. Another modern and perhaps more frequent cause of traumatic brain injury is a road traffic accident, and an example is that was vividly portrayed by physician Claudia Osborne in her illness memoir titled Over My Head. Although she had no memory of being injured and only a dim recollection of the 9 months preceding her rehabilitation, Osborne managed to piece together her story from the accounts of friends and family. Her accident happened when, she said, an old Chevy came from round a corner and hurtled towards her and her friend who were riding their bicycles. She said his turn was too wide, putting him on the wrong side of the street and directly on our path. She added that he reached us in seconds. The grille of his car struck my bike full force, catapulting me over its roof and into the air and land on my head. The emotional sequelae of traumatic brain injury are as devastating as the physical and cognitive fallouts. Take, for example, the story narrated by Polly Williamson in her illness memoir titled, Where Did I Go? Rediscovering My Identity, Lost After a Traumatic Brain Injury. Williamson was taking part in a small horse competition early in December 2011 when she said, half a ton of horse kicked me in the head. She recalled that she was simply training a young horse which slipped and fell over, panicked. And as the horse scrambled to right himself, crazily thrashing out, she said its hind hoofs became cannons flying in all directions with no control, and one caught her square in the head. She had no recollection of the accident itself, nor of the 7 weeks after that, what she referred to as being sunk in post-traumatic amnesia. Williamson's narrative highlighted the emotional turmoil that follows traumatic brain injury. For example, she wrote that during most of the recovery period, she was emotionally numb and shut down. She said she existed in her shell, feeling no anger, pain, or sadness. Even when she first went back home, she said, home is strange and the bond with my children is not there. And after this state of emotional vacuum, Williamson went on to manifest extreme emotions. For example, she wrote of episodes of rage when she would fly off the handle within minutes. She said, I screamed, ranted, and raved. I had lost the power over my body and my actions. I was a half-crazed, scary, screaming woman. Interestingly, she also had fits of giggles and episodes of crying without feeling sad, typical of what are called pathological laughter and crying. The narratives of Crimmins and Osborne also describe the other symptoms that follow traumatic brain injury. These include amnesia, lack of insight and self-awareness, poor concentration, easy distractibility, disinhibition, poor short-term memory, excessive sleeping, confabulation, making up things, incessant masturbation, and Capgras delusion, believing that somebody close is an imposter. Amongst the other debilitating symptoms that can follow traumatic brain injury are headache, benign paroxysmal positional vertigo or BPPV, and then PPPD, which is persistent postural perceptual dizziness. Others are dementia, alcohol abuse, stroke, traumatic aneurysms, vasospasm, and even Parkinsonism. Other rarer but equally consequential complications are post-traumatic hypopituitarism, paroxysmal sympathetic hyperactivity, the minimally conscious states, and even vegetative states. Perhaps the most important investigation of a traumatic brain injury is head imaging, and this was illustrated by the case of Alan. Crimmins wrote that Alan's brain imaging showed that he had sustained extensive damage in the frontal lobes and that there were areas of brain swelling and bleeding. The scans enabled his doctors to make what she said was the official diagnosis of DAI, diffuse axonal injury. Axons are the nerves. She explained that this meant his neurons had become jangled, perhaps sheared off. The scans also showed that Alan had subdural hematomas, or blood collections over both frontal lobes. The prompt and effective management of traumatic brain injury is critical for survival and for good outcomes. Crimmins described in minute details the important treatments that Alan had. Apart from a urinary catheter and a feeding tube, he also had a neck brace. He had artificial ventilation, and he was put in morphine-induced coma to minimize his movements and enable everyone to concentrate on his brain injury. And that is in her words. Furthermore, she said Alan was given mannitol, what she described as a diuretic that drains fluid from the cranial cavity to help keep the brain from swelling so much. And he was also treated with Dilantin to prevent any further seizures. Alan was also kept exposed on the intensive care unit because, she said, or she was told, the colder the brain injury patient, the less the chances of brain swelling. The management of traumatic brain injury is rather more extensive than described above. For example, apart from mannitol and hypothermia, the treatment of raised intracranial pressure from traumatic brain injury may include decompressive craniectomy, which is removing part of the skull, and surgery to remove any blood collections. We now come to an equally devastating form of neurological trauma, which is spinal cord injury. And one of the most graphic depictions of this I have read is that by journalist Melanie Reid, titled "The World I Fell Out Of." Reid was 52 years old when she severed her spinal cord. She wrote that it happened on a cold, blustery Sunday in late March, the kind of ordinary day in which, she said, extraordinary things happen. This was the day, she said, I fell off my horse and broke my neck. She said she found the accident particularly galling and inexplicable, being that she was a competent, experienced rider on a competent, steady horse, being coached by a competent, qualified person. One moment, she said, she was blissfully ignorant and complacent, and the next, she said, I was pinned to the ground with a broken neck and fractured lower back. The accident happened right at the take-off stride as she was going to take a second jump when she said the horse ducked out sharply as she carried on going. She experienced a blinding red flash before she felt her whole body suffuse with what she called a most beautiful, intense feeling of warmth, referring to this as my own internal nuclear explosion, my own terrible mushroom cloud. She said, I can still feel the bitterness in my mouth at the unfairness, the bad luck, the everyday, non-earth-shattering mundanity of the whole thing. The loss that accompanies spinal cord injury is among the most devastating in neurology. Melanie Reid illustrated the impact of this loss when she said, the territory you lose is vast. Your whole system falters, stutters, nearly collapses. She wrote that 4/5 of my body has divorced me, but it's still attached to me, quipping that I'm two people, me and the rest of me. She referred to spinal injury as a planet rare and cruel unto itself, and one in which your world shrivels exponentially. Melanie Reid's memoir also vividly portrayed the physical burdens of spinal cord injury. For example, she wrote of her turgid, spasming limbs which refused to cooperate, saying they would make me jerk and jackknife, chest to knees. She also said her legs may go into a violent plantar flexospasm, my legs straight out like telegraph poles, knees grinding together, toes straining down, back arching. In describing the mechanisms that can result in spinal cord injury, Reed remarks that life quite simply chose to leap out and attack us. She listed an almost endless list of the risky routes to spinal cord injury, which, as we've seen, include road traffic accidents, but also falls from bikes or horses or walls, crashes on the piste, dives into swimming pools, rugby tackles, violent assaults, attempted murder, war, vascular accidents, and complications from tumor operations. Other causes of spinal cord injury similarly arise from what are otherwise routine activities. For example, take the case of Lauri Palongo Zapula, who wrote about her experience of spinal cord injury in a swimming pool in her memoir titled "You Are Going to Walk." Zapula recalled that on the afternoon of her tragedy, she and her friends were doing jumps and flips into the pool just like we had so many times before. She said her accident all happened in nanoseconds. She had very little recollection of hearing the splash of the water before she hit her head on the bottom of the swimming pool. She recalled tumbling around at the pool bottom and clearly remembers the pounding and heaviness of her head, which she said just wants to fall backwards and rest. She said that the ridiculous, unpleasant, painful and nasty part is that I knew instantly. I'm paralyzed, my body just shut down, and my head and neck are vibrating all the way down the spine like the coils of a cheap massage device. Apart from these relatively dramatic causes of spinal cord injury, there are also the extremely banal ones. Melanie Reed listed such mechanisms as falling off beds, stumbling off curbs, and tripping over slippers or coffee tables or dig leaves or manhole covers. An illustrative case of the banal routes to spinal cord injury is that of Jim Linnell, as he narrated in his memoir titled "Taking It Lying Down." Linnell was 77 years old and on holiday with his wife when they decided to go for a walk on the beach at night. It was pitch dark when they tried to step off the porch of their holiday rental house. Forced to feel their way and trusting that the steps are straight in front of us, he said they stepped off the porch, but this was onto air, falling 3 feet to hard ground. This banal accident left Linnell with life-changing paralysis, being only able to make small movements with his right hand. It also made his body to feel like a foreign object. What do we know about the clinical manifestations of spinal cord injury? Perhaps understandably, there is a disproportionate male to female ratio, and there is a tendency for it to affect people under the age of 30 years. But perhaps more difficult to understand is that the manifestations of spinal cord injury go beyond the nervous system. For example, spinal cord injury can lead to impairments of bowel, bladder, and sexual function. It also comes with risks of deep vein thrombosis, wound infection, pneumonia, urinary tract infection, intestinal bleeding, kidney stones, and immune deficiency. What does the care of spinal cord injury entail? Along with the acute surgical treatment of spinal cord injuries, there are equally important medical treatments. For example, in Melanie Reed's narrative, she was treated with midodrine, and this was to prevent fainting, with nifedipine for autonomic dysreflexia, and with baclofen and botulinum toxin for spasticity and spasms, and she also had rehabilitation. There's a place for steroids in the management, but this remains a controversial topic I will not go into any further. On the positive side, there are many investigational treatments of spinal cord injury, which include spinal cord scaffolding using bone marrow stromal cells, and riluzole for its potential neuroprotective role. To explore the clinical perspective of spinal cord injury further, I will be speaking to Susan Mockler, author of the book titled Fractured, in the next episode of the podcast. Thank you so much for listening to or watching this podcast, in which we started exploring the manifestations of neurological trauma. If you found the podcast enlightening, why not consider subscribing to the Neuro Checklist website and perhaps exploring my book titled Surfing the Brain? And why not subscribe to the podcast, iTunes, Spotify, or YouTube channels to ensure you don't miss the next episode in conversation with Susan Mockler. Do join me then. Thank you very much.